Medicare fraud affects every American. Waste, fraud, and abuse take critical resources out of our healthcare system and contribute to the rising cost of healthcare for all Americans. The National Healthcare Anti-Fraud Association estimates conservatively that at least $60 billion of the more than $2 trillion the United States government spends on healthcare every year is lost to fraud. On top of that exorbitant amount of money is the toll fraud takes on Medicare beneficiaries. Here to lend some support and advice is Sharon Ayers with the Senior Medicare Patrol Program. Sharon, thank you for being here.
Thank you for having me.
Well, it's obviously a huge problem, and those are some huge numbers
Yes.
I'm just using there. Give us some specific examples of what we're talking about when we talk about Medicare fraud.
Yeah, Medicare fraud, basically, like you just mentioned, costs our country about $60 billion a year. When medical providers, durable medical equipment companies, or even an individual or a beneficiary basically charges things to your Medicare statement or your Medicare statement that you did not use or you did not authorize, then that consists of fraud and abuse. There's many different ways of fraud and abuse that are going on in our country. But anything that you as a Medicare beneficiary did not authorize is should not be charged to your Medicare statement.
So this is something that, I mean, is this primarily healthcare providers? You mentioned durable medical supply people or beneficiaries. I mean,
Right.
Give us some specific examples. Say, like, are they saying charging you for use of a wheelchair for a limited time? I mean, give us
Right.
some specifics.
There are certain kinds of Medicare, certain kind of medical services that are more prone to fraud than others. But for example, durable medical equipment companies and home health agencies are the worst. But I will say there are some good providers.
There
I don't
really
want
are.
to make it seem as if all providers commit fraud. But for example, providing a beneficiary a more expensive wheelchair than the one that was actually charged. A doctor billing for services that a patient never received. That's considered fraud. A hospital, for example, charging all of their patients or diagnosing all of their patients with bacteria pneumonia as opposed to viral pneumonia, just to get higher payments from Medicare. All those things lead to an increased number, the amount of money that is spent every year on fraud and abuse.
Well, I'm sure, as you mentioned, the majority of providers and all these people are totally above board and do a great
Right.
job. But unfortunately, there's always one or two bad apples, and this represents
Right.
a considerable amount of money that we could use for something else.
Exactly.
So what are the warning signs, and how do people catch this?
Okay. One of the things that we try to educate folks about through the Senior Medicare Patrol Program is to read their Medicare summary notices. Or if you are a Medicare beneficiary who's enrolled in an HMO, read your summary notices when they come to you. By reading it, you will be able to catch things that are on your statements that don't really exist or that shouldn't be there. For example, if you keep a journal of all of the things that happen when you go to the doctor, if you keep a journal, then you're able to compare what's in the journal to what actually occurred when you went to the doctor.
So that's a good way to protect yourself. So basically you're saying write it down as it's happening so you're not trying to remember when your statement comes, and then you have
Right.
something to actually compare.
Right. So basically that will help the beneficiary so that they will, and when there is wrong charges, they'll know how to report those charges. But many a times there are mistakes. It's not all abuse. All doctors or medical providers are not trying to abuse the system. Sometimes mistakes do happen.
Sure.
So when mistakes happen, we ask people to just report it so that those things can be corrected. But I'm sorry, Jeff, you asked me one of the things, warning signs. What I will tell Medicare beneficiaries to be aware of more than anything else is people who ask you for your Medicare number. You need to really safeguard your Medicare number. Treat it like you treat your credit cards.
Okay.
Because people should not ask you for your Medicare number. Only your doctor or your medical provider, your pharmacist. No one else should be asking you for your number. And a lot of times, folks who are trying to abuse the system will tell you something is free. and then say, what's your Medicare number? If something is free, it's free. They don't need your Medicare number. They don't need any information from you if it's free.
So that would be one of the warning signs that someone might be
keep
their eye open for. What are some other warning signs that may just pull up some red flags and show them, hey, I need to kind of think about this a little bit more?
If people call you and say they're from Medicare and they want your number, they're making a change. Medicare doesn't make phone calls to beneficiaries for no reason. They don't do that. Another warning sign is someone coming to you to say they changed your plan or trying to scare you into changing your plan. You have the right to change your plan when you get ready to change it. Nobody should make you scare, try to scare you into changing your plan.
Well, you mentioned fear, and that's a good point. Or sometimes are people reluctant to report it, even if they catch it? And
they
why?
Are. Well, because sometimes people are afraid that their doctor will stop seeing them, or they're afraid that their services will go away, and just think that it just takes too much time. But that's not the case. That's not the case at all. Your doctor can't stop seeing you because you reported it. That's why Florida has a fraud hotline number so that folks can call in, report it. Your doctor doesn't have to know that you called to report, that there was some type of fraud or abuse occurring. So
we're pulling up a phone number through the segment, but remind everybody again verbally, what's the phone number they should call?
The Florida toll-free fraud hotline number is 866-357-6677.
Okay. Well, that's great. Well, what do you think is just really the most important thing people need to know to help stop this? I know you're trying to control this and control the problem. So what's the best thing they can do?
The best thing that people can do really is to read their Medicare summary notices more than anything, because Medicare, whenever anything is billed to your account, Medicare will send you a summary notice. Read that summary notice so that you can identify any erroneous charges. Because if you don't read it and you don't pay attention to it, then you won't know. It's hard for us to catch those folks who are falsely billing charges to Medicare.
Well, that's great information, and also thank you. I know you provided us some information for an article we have in this issue of Coming of Age magazine on Medicare fraud, so I hope our viewers will call in to get that article as well.
Thank you.
Thank you.